here we're going to work the sole of the foot, the plantar fascia. This sideline position is great because it allows us to change the depth of our work. For example, there are 4 layers of muscle in the foot. So by having Kiki in this position, we can easily manipulate the amount of flexion and extensions of the foot. The more bind we put here, the deeper it allows us to go. So for example, if we're working Kiki in this position with our toe flexed, it's very hard to penetrate layers 2, 3, and 4, right? Because the Achilles, the plantar fascia is keeping us out. But if we plantar flex our foot and flex the toes, that gets soft, so it allows us to go beyond that structure. So this position is great for that, so it just allows us a lot of motion. A couple of ways of working this area. I'm going to show you a couple of different versions. So I like to work across. So most body work, they normally work the line of the tissue, which is great. But here we're going to show you to work across the line. So I'm starting just around the calcaneus, and I want to trace the whole calcaneus. So it's going to be here. My pressure straight down. I'm just following the calcaneus around. I like to use knuckles here. So with this hand, it's like a, see how I'm twisting my knuckles to trace. Then I like to move up, do the same thing. So I find the navicular, this large prominent bone here. I start my stroke just under that prominence, and I stroke across. You can look across this way. This is my preferred angle, actually. So now I'm going to put Kiki to more plantar flexion. I'm going to point my foot more. I'm going to use an elbow, guys. I'm going to start in between the calcaneus and the navicular in here. So I'm plantar flexing, soft elbow, relaxed elbow should I say. I apply pressure down. As I do that, I start pulling my elbow toward me. And in order to move, I don't move my hand or my elbow. What I do is find that soft spot. So I get that fascial hook, that fascial bind. I apply pressure. Then what I'll do is I'll move Kiki's foot. So I'll show you again what I'm doing. So I'm just plantar and dorsiflexing. So I'm really pointing the foot. And by virtue of doing that, when I go here, so when I do this, when I release, my elbow slides because of the skin. So I'm like this. So I start here. I plantar flex, point Kiki's toes. When I come back, my elbow moves down just a smidge because of the skin pulls back and forth. It's just here. Feel okay? So I'm just doing this. Can come high up on that ray, reinforced thumbs or laterally stabilized thumbs here. I'm just pushing down. This is great for especially people with bunions or rigid big toes, which is most of us. So here, if I want to penetrate deeper, I'll flex the toe, big toe here, softens the, so this tendon, you can probably see it's kind of tight on camera. If I flex it, You see the divots of the skin, takes that out. I can work deeper. If you don't want to use thumbs, fingers, or knuckles, knuckles will be here. Many ways to work the foot in this position actually. So I'm going to invert Kiki's foot. Inverting. I'm going to here, and I'm going to come across this way. So I'm cupping Kiki's foot, and I'm just creating like a pressure. I'm pulling and pushing. So I'm torquing. Most people need more mid-foot mobility in inversion and eversion. So this right now is inversion. To evert the foot, it'd be the opposite. Grab and twist. Maybe here. So I'm pulling with my fingers. I just follow the tissue round. Knuckles. It's not as easy to do with an elbow, but it's doable. So I'll be here. I'll follow it around this way. So I start my ankle on the top. As I twist the foot, I come around and I'm pushing in this way. You okay? So when you're working the foot, don't always, sometimes you can ask for no movement from the client, but every now and then ask for some plantar flexion, some dorsiflexion, some inversion, some eversion, some active range of motion. So don't be afraid to ask your clients to move and put them in these sideline positions. It just opens up a whole new possibility for our work.